So you've had this done before, so what we're gonna do is, I do it a little bit differently now. The first thing I do is inject the joints, because often when we pull, the joint is uncomfortable. So I'll inject that at the beginning with some local anesthetic. And I put the anesthetic on the top here. And this way we can put some numbing in the joint and not affect the nerves, which are on the other side, on the front side or volar side. And again here. And this is a bit more important with someone who's got more of a contracture in the finger joint, but still helpful. And then I always start from tip to heart, and that way I can avoid numbing the nerve too much.
Okay.
And you'll let me know if you feel anything electrical as we work here. And that means I want to be away from that spot. Now these injections will hurt a little bit more, poke and ouch. It's variable how much people will put in there. Now the technique involves feel, because the gristle feels different, the nerve feels different. And sometimes it involves listening, because you can hear the gristle. And it involves sometimes some feedback from you. And there's difference in approach. Some people will say don't approach it where there's no soft tissue. I find that actually for me works best. And I can feel and hear the cracking. So I know I'm in the gristle as opposed to a nerve. I also use a needle that's small enough that if I even go through a nerve, it wouldn't cut the nerve. And ideally, I like to break it up in more than one spot. And then as we get further back in the hand here, especially once we get to the crease, the nerves are held underneath the gristle there. So it's easier to go with something a little bit bigger. Poke, sorry. And that's never very comfortable, so I apologize for that. So at this area here, I'll often go with a bit wider gauge needle. And it's always a question of making sure you're not through the gristle and into the tendons. There is a risk of cutting a tendon, which is true with the Xiaflex as well, breaking a tendon, and if it happens, it's going to be the small finger. The reason I tell people no heavy grip with this is if there is a scratch in the tendon, it'll heal itself in 2 weeks. I've done 5,000 probably. I've had one tendon rupture. I've had 2 people buy something very hot and put it against their hand and get a burn while the numbing agent is still in there. One lady bought a coffee and held it in her hand for 4 hours. And I've had 2 infections, both in the first year, and both were people who went lawn bowling the next day. And those have been all the sort of problems. Obviously recurrence can happen and will happen. I tell people if you do lots of good stretching, then you should get 2 to 5 years out of it. And the great thing is we can always repeat it. Poke again. I don't have skin tears anymore because there is no shortage of skin. There's just places where the skin is more adherent and you have to release it from those areas to avoid skin tears. But Dupuytren's does not cause a shortage of skin, which is what I was taught. We'll get rid of that pucker there. Sorry, little poke again. Same thing here. And that's through that little hole there. So, doesn't look very nice. We'll have to click that out there. So this is something we can do for puckering, especially if there's a lot of it where we're worried about a skin tear. I do is I take a larger bore and I separate the nodules from the skin and the Dupuytren's from the skin, so the skin can now move freely and you don't get puckering to the same degree, and you can prevent skin tears because you get more skin mobility. Any pain there? Is that okay?
Yep, no pain.
And that's something that I've added probably over the last few years that I didn't do at the beginning, that I find not as much in a hand like yours, but in hand where things are really stuck down in the finger makes a big difference. So that gets rid of that pucker there.
Mm-hmm.
And sometimes if you have a big nodule like this and you just want to help to break it up, I do think cortisone does help. Not immediately, but if you use cortisone in combination with the deep massage, for example using a golf ball, I think it will help reduce that nodule some. And open all the way and close tight, so you know the tendons are intact. So you just have to take it easy for the first little bit, and you want to use hydrogen peroxide. People watching this may believe there's some controversy with hydrogen peroxide. Some people believe that it impairs healing. It actually helps healing. That's what the science shows in the available doses. If you use a high dose or a high concentration rather than a high dose, then yeah, it does have impairments to wound healing. But the doses you get at the pharmacy, the 3% hydrogen peroxide, does actually help healing and keeps the wound a little bit cleaner. You just put a simple dressing on, no splint. Here's our dressing. You lift your hand up for us. Great. I like to use this dressing. It's Coban. Some people know it as Vet Wrap or Sports Wrap. It's made by 3M. There are some knockoff brands as well. And it's easy because it's got no glue and it just sticks to itself. Just have to make sure it's not too tight. All done.